Hi, so this is my first video of 2021. Actually, it's my first video in like almost a month. And it's weird because I actually had so many videos planned and I don't know. I was on holiday. I just wanted to enjoy it. So, yeah, it's my first video. I completed my first week of clinical just now. So I had clinical yesterday on Tuesday, and then today I had my second day on Wednesday. I'll just talk about it real briefly, I guess. So yesterday was my first day. So I'm at a new hospital now on a new unit. I'm at a hospital that's actually closer to where I live. This time I'm on the med-surg floor. Last semester I was in ALC, which is alternate level of care. So on that unit, we had mostly geriatric patients, and those patients were like long-term patients of the hospital. Like those people were pretty much just waiting to get into homes. So here on med-surg, it's more acute. People are obviously, it's med-surg, so there's a lot of post-op patients and like internal medicine patients. Okay, so yesterday, my first day, it was just orientation. I got there in the morning, and it was like just 5 hours of our instructor just taking us on a tour of the unit and explaining things and how it all worked. That was it. And then today was just a buddy shift, shadowing. So I didn't do any work. I just shadowed my nurse the whole time. And she just kind of explains how things work at this hospital, because it's actually very different from the last hospital that I was at. And yeah, that's about it. What did I do? So my nurse had a 4-patient load, but one of her patients was actually being discharged later that day, so it was like 3 patients really. One of them was actually at the hospital. So anytime we went in that room, we had to make sure that we were giving him extra good care because he's one of the there. And then who else? And then we had another patient who actually was one of my residents at one of the other homes that I used to work at or do placement at. So I feel like I see my residents everywhere. And then the third one, who was my third patient? What even was our third patient? Oh yeah, our third patient. So it was this gentleman who'd suffered like a hypoxic brain injury. So he was unable to talk. He was nonverbal. He could just kind of like moan and make sounds. He could kind of say, like you could kind of hear yes and no when he'd speak, but that was about it. And at one point it was so sad. So there's one point too where she and I went in the room to check on him, and he started like tearing up and crying, and he kept like mumbling some word, and she couldn't understand what he was saying. And finally, like I caught on, he was trying to say wife, and I asked him like, did you want to call your wife? And this poor man just started like bawling his eyes out, and then I started crying, and then she started crying, and yeah, so that was it. Those are my patients. They didn't really require a whole lot of work, like I don't know. Didn't really require a whole lot of work, but my instructor did pull me aside at one point, and she let me do a sterile dressing on a surgical wound. So yeah, so this guy had knee replacement surgery, and so I just did the dressing change on that. What else? One of my classmates got to insert a catheter, so I stood in and watched that happen. That was pretty cool. She did a really good job. She actually got it in on the first try. I would have been so scared doing that. Oh my gosh. But I'm probably gonna end up doing a lot of them. I feel like this is a really good unit to be on, because I feel like it's just gonna expose us to so much stuff, especially considering my last unit. Like I literally did nothing. Like I don't know what I did on that unit, but I learned very, very little. So I'm pretty excited to be here. And now I am on my way home, yes, but I'm also stopping at my school because I need to pick up my lab kit. So because classes are online, including labs for whatever ridiculous reason, the school provides us with these lab kits that we use at home. So I'm on my way now to go pick that up, and then I will go home and shower, and then... Okay, so I'm home now, but like it is so nice out. It's like 2 degrees, so I figured I'd take my dog for a quick walk because he probably really needs it. Charlie, no. Charlie, come here. Come, get out of the snow. Good boy. Oh my god, it's so slippery. I'm probably gonna fall down as well. Oh my god, I'm definitely gonna fall. So if you're at all curious about what I picked up from school in that lab kit, I've got a bunch of stuff here for blood collection. So a bunch of tubes, needles, gloves, a tourniquet, some IV flushes, an IV bag, IV tubing, just a bunch of stuff for IVs and just like needles and syringes and stuff. So yeah. And if you hear that barking, that is my dog. So someone close to me had to leave town at the last minute, and they've got a cat that needs to be taken care of. So I told them that I'd stop in a couple times a week and help with the cat, keep her company, because she's used to always having people around, and now she's got nobody. So I'm on my way there now to go check on Phoebe. And yeah, I actually have a Zoom meeting at 3, so hopefully I can find the Wi-Fi password while I'm there and watch my meeting from over there. I'm just gonna stop at Tim's first to get a coffee though.
Hi there.
Hi, can I please get a small double?
Something else?
That's it. Thank you. It's so weird filming in this car. I feel like the camera is just like right up in my face. When I'm in the SUV, the camera seems so far away.
There you go.
Thank you.
No problem.
Okay. Oops. Now, let's go see Phoebe. Back in the SUV again, because have you seen what it looks like outside? Last night when I was driving home, I got home last night a little after midnight, and that's when the storm started. So I got home just in time, but yeah, I think like 20 centimeters fell overnight, and it's still going. So I have to take the SUV because I have an appointment at like 8 o'clock on a Saturday morning, and yeah, that's where I'm off to. Hopefully this doesn't take long. I mean, I think it probably will, but hopefully it doesn't, because I really need to start studying. I've had a lot going on these last few days. It's been really busy and really stressful, and I just have not had a chance to sit down and do anything. And I've got a test on Monday that I don't really think I'm prepared for. But yeah, I don't know. We'll do the best we can, see what time we get out of here at, and then study. Okay, so I've been home for a couple of hours now, but I'm only just starting my work because like it's been a rough couple of days, and I just needed to like mentally and physically like regroup. By the way, if you have never smelled one of these diptyque candles before, like, you are missing out. They're all over Instagram, and my friend got me this for my birthday a few weeks ago, and it is incredible. Okay, I think the wick needs to be shortened because this flame is huge, but this thing smells incredible. It smells like perfume. It is so nice that, like, I feel bad even lighting it. I feel so guilty. I just want to keep it forever, but at the same time, it smells so good, I just want to light it. So, yeah.